My name is Mary Jedlicka. I live in Columbus, Ohio. I'm originally from Atlanta. I am a nurse anesthetist at one of the local hospitals here in Columbus. And some of the fun things that I like to do include Ironmans. I've done 4 or 5 of them. I have the Chicago Marathon coming up next month. And my mom is my Sherpa, so I haul her all over the country with me and then just put her up in nice hotels, and then she's my little cheerleader. I stay really active. I like to run and swim and bike. I travel as much as possible. I have a lot of family down south, so I go down and see them a lot. And you meet such interesting people, and so many people have different stories of why they do the racing. I just like the energy that is involved and the type of people and the positivity, and it just keeps me healthy and strong so that I can continue my job. I'm a nurse anesthetist in the OR, so if you haven't had surgery, that means when a patient goes back to the surgery, I'm the one who sends them off to sleep, puts the breathing tube in them, and then basically makes sure they stay under anesthesia. Depending on the type of procedure that you're doing, you could be on your feet until the surgeon settles into the surgery, and then you get to sit down. I've been in the reserves for like 5 years. 5 or 6 years. I think the cutoff for the Army is like 42. I've always wanted to be in the military, and it was just something that I wanted to do before I got too old and they needed CRNAs. It was back in 2017. I'd always had like healthy checkups with my doctors, never had any issues, and I was on the ICU floor at OSU, and one afternoon I just started hemorrhaging. So I went to the doctor and they did a biopsy and they told me that it was cervical adenocarcinoma, which I guess is a rare deeper glandular cancer. So I ended up having surgery in May of 2017, and I had a total hysterectomy, and the doctor removed my lymph nodes just to make sure that it didn't spread to the rest of my body. It was very, very early stages. Even though there was a risk of lymphedema, I didn't really think about it at that time, but you can't go back in time and change things. I remember being on a trip with my friends, and my right leg started swelling, and I didn't really think much of it, and it just gradually got a little worse. Before my diagnosis, I was active. I loved doing Ironmans and races, but even now, post my diagnosis, it's more important. I'm just of that mindset. I'm not gonna let it stop me from doing anything. And some days it feels heavier than others, but it's getting better. I feel like life is so short, and it was kind of like a wake-up call. Sorry, I get go emotional. That I just want to make sure that I do everything that I can, because I see so many people who sit around and just let life pass them by. So within the last 6 months or so, my most recent visit with my physical therapist, she knows that I stay active. I'm doing I'm proactive as I can be with my lymphedema. And then she let me know about the Koya compression system. And basically just said there's a new device on the market that I would be a good candidate for. If I have somewhere to go in the evening, I feel like I could do that now and not have to worry about, wait, I gotta do my other compression for an hour before I can go out. Usually when I get my morning break, I'll go into our locker room, take my scrubs off, and then put it over my compression stocking, and then I go back to the OR, and I'll walk patients back and forth. I'll have it on for an hour. If I'm home during the day, while I'm running errands or cleaning up the house, I'll just pop it on and walk around with it for an hour. Just a whole part of my routine to keep my leg healthy.